introduce the wonderful Dr. Margo Pearce and Sherri Pooyak for their work with the Cedar Project. And yeah, take it away.
Okay, here we go.
Oh, it's working. Perfect.
A research and evaluation specialist with the Indigenous Cultural Safety Team at Fraser Health. And when I'm there, I'm working on the traditional unceded territories of the Coast Salish and the Nefwekmak peoples, as well as the 5 Métis Chartered communities. Really glad to be here today.
So we'd like to begin our presentation by acknowledging those that have been involved with the Cedar Project.
She'll have to stay unmuted.
See, there is quite a few of them. Sorry, I believe it's 99. Margo, is that correct?
We're at 122 now.
Oh, sorry, 122 participants who have passed away over the course of the Cedar Project partnership. So we'd like to acknowledge them and their stories, and in recognition that they have shared their lives with us, and we continue to hold their stories in a sacred way. The Cedar Project takes place on the traditional territories of the Kwale-Tene, Coast Salish people, Musqueam, Tsleil-Waututh, and Squamish people. And we are very grateful for them allowing us to do this work on their territories. The Cedar Project would first and foremost like to acknowledge the elders that are involved in the project and that guide the project, that guide us in the research, but then most of all, they guide us spiritually as well. We couldn't do this work without the Cedar Project staff, which is the 3 pictures of the women you see there, as well as we'd like to acknowledge our one of our partners who passed away a few years ago, Presinguno, and we are forever grateful for the work that they do. So we move to our research and context. And
sorry to interrupt, but Rich, we're not seeing the video progressing.
And he says, because of historical traumas, we have had to
I'm sorry, Matt.
I'm not seeing the video progressing, and so I think we maybe need to try something once again.
I can try sharing my screen, you guys. Just give me a moment here. And please let me know if it works or not. I'm sorry about this technical difficulty.
And we're at 3:08. Or was, anyway.
My name is Sherri, and I want to thank you for coming to our presentation this afternoon, for watching it online, wherever you are. I'm already ancestry.
Yeah, we have video, but the sound isn't great.
Okay, one moment. Please let me know if this is better.
And when I'm there, I'm working on the traditional unceded territories of the Coast Salish and the Nefwekmak peoples, as well as the 5 Métis Chartered communities. Really glad to be here today.
We'd like to begin our presentation by acknowledging those that have been involved with the Cedar Project over the years. We always begin our presentations by acknowledging the new voices of the participants who have shared their stories and shared their lives
we'd especially like to honor the participants that have passed away. And as you can see, there's quite a few of them. Sorry, I believe it's 99. We're at 122 now. Sorry, 122 participants who have passed away. So we'd like to acknowledge them and their souls in recognition that they have shared their lives with us and we continue to hold their stories in the same way. The Cedar Project takes place on the traditional territories of the Clearly today. Coast Salish people, Musqueam, Tsleil-Waututh, and Squamish people. And we are very grateful for them. In the project and that guide the project to guide us in the research, but then most of all, they guide us spiritually as well. We couldn't do this work without the Cedar Project staff, which is the three.
Okay, I'm receiving some messages that the sound still isn't great. So I've paused the video. If people are having trouble hearing it, Sherri has offered to share her screen and we can just fast forward to this point in the video. Sherri, is that okay with you?
Yeah, I'm just, I can't see where we're at, 2 minutes and something.
We're at 2 minutes 39. And I'll stop sharing my screen so you can go ahead.
Okay, I'm just going to turn off my video just in case the Wi-Fi is off. The Cedar Project staff, which is the three women, three pictures of the women you see there, as well as we'd like to acknowledge our one of our partners who passed away a few years ago, Preston Guno, and we're forever grateful for the work that they do. So we move to our research and context, and this is a quote from one of our elders, Earl Henderson. And he says, because of historical traumas, we have had to rebuild self-esteem and self-worth, which are built into our culture. So when we look at ceremony culture and what we do traditionally, all of which build on a person's self-esteem and help them find their place in the world, this is what balances our mental, emotional, physical, and spiritual wellness. For the young people who are struggling, it is our culture. Our culture that will give them strength. We keep this in mind as we move forward.
So the Cedar Project began in 2003 when two researchers from Vancouver out of St. Paul's Hospital were invited by Indigenous leaders in Vancouver and Prince George to look more closely at colonial harms that are impacting young Indigenous people within the context of the emerging HIV and hepatitis C epidemics. And back then, things were really exploding and definitely simmering in Prince George. Overall, the Cedar Project was designed to provide Indigenous partners and investigators with the epidemiological evidence that they needed to lobby on behalf of their communities and their young people. Cedar, from the beginning, at the direction of the Cedar Project Partnership, has been a strength-based approach to the work. All participants have inherent strengths, and that is acknowledged throughout the work. We also acknowledge that cultural connection is the foundation of thriving health, and that is definitely the paradigm in which the Cedar Project works.
So we're going to quickly just talk very briefly about the what our governance looks like. And as you can see, we're quite a large. There's a number of us, so we don't do this work lightly or take it lightly. We have many voices on the overall project. These are just kind of some guidelines that we follow, some the way that we work. I'd like to highlight that we as Indigenous people and part of the partnership, inform the research and design in all aspects. We oversee how the projects are done. And one of the most important things that I think we do is provide student mentorship to students that are engaged and do their research with the Cedar Project.
I'm one of those lucky students.
So we come at this work with an emphasis on really the way that we do it is focusing on Indigenous methodology, looking at culture as being an intervention, as Margo has already pointed out, that it's strength-based, that it's culturally safe, and that it's healing-centered. So what do we talk about when we mean, what do we mean when we talk about cultural safety? So we acknowledge that a lot of our participants have grief in all sorts of ways. As many Indigenous people know, grief and loss is a huge part of our world and our experiences. We try to emphasize providing traditional foods for our participants on special occasions, memorials. We're very lucky to have a large network of supporters, so people that will provide salmon, will provide seaweed, will provide those kind of traditional foods for people. It is also a place where in both offices in Prince George and Vancouver, where food is provided, support is provided if there's participants are looking for housing. It's a safe place for people that if they're high at the time, they can go and relax and chill out. They don't have to worry about being harassed. They don't have to worry about being kicked out of it, that they can go and just, you know, be comfortable and feel safe. It is also a police-free zone. So if police do enter the Cedar Project, they are kindly asked to leave the office building and they are met outside with one of the staff members. Zoomed in there.
I'll just speak briefly to the overall study design of the Cedar Project cohort. It's over 800 young Indigenous people who self-identify as Indigenous, who have used drugs in the past 30 days and are at risk of HIV and hepatitis C infection. As Sherri has described, it's a community-governed cohort study. It's been going since 2003. When participants enroll in the study, they're between ages 14 and 30. As you know, Cedar has been going on for a long time, so that means participants who started at the beginning have aged, and we have refreshed the cohort a couple of times to enroll younger participants as we go along. We also do follow-up interviews every 6 months with a quite lengthy, in-depth questionnaire, and we carry out HIV and hepatitis C testing at each visit as well. There are a number of sub-studies in the Cedar Project, and this is a list of the main ones. We've had a number of intervention studies as well, including a WellTel mHealth study and hepatitis C and HIV blanket programs, which are intensive case management in a culturally supportive framework. And our most recent study is the COVID-19 study, which I'll talk more about in a few minutes.
Sorry, my apologies. I'm here, Margo.
Yes, that one.
Sorry, we're a little awkward today, so please bear with us.
Whiplash.
We, as the partnership, we follow what we call our Indian ethics, in the sense of we have a Western ethics, and then there's the Indian ethics, which is really to, you know, some of the what would be considered unethical, such as having a relationship with participants or supporting them in finding housing or doing, you know, things that were just part of how we take care of our own, is the way that we go forward. we want to ensure that our participants are looked after, and not just in a do no harm kind of way, but in all aspects of their lives. So providing things like food, taking to them appointments, going with them to appointments, things like that is all part of the project and the way that we do some of the work, which is a very strong value for us. For us, research really is ceremony in the sense that, we have elders there, they're with us, they're supporting us, they're, not just the partnership, but the participants as well. They are there for the participants. They are there for those of us that are younger that are on the partnership, for the students, for the staff. So we incorporate all of those things at the same time and have our elders attend and begin our meetings with prayer and, provide medicines if participants want it and what they're looking after. And as well as, researchers making sure that we take care of each other and that researchers aren't left alone. They are part of the process, and we do see, especially for non-Indigenous researchers, the importance and value of having them as part of our work.
A big part of the lessons that I have learned, certainly as a student, has been around accountability and learning how to ask good questions that are leading to an impact in the community that is relevant, that is beneficial, that is strength-based and uplifting. And that means listening to the elders in the study. That means taking direction from the partnership and from the investigators on the study, and doing this work all in a way that honors the young people who spend their time to tell us about their lives, and honoring them within the intention of improving well-being, supporting well-being, and just being accountable to all of those intentions.
So some of the teachings that have been passed on to all of us, and I think, and things that I feel like I've learned as a mentor, is the concept of reciprocity and learning from each other and seeing each other as equals. So there's always this give and take approach in the work that we're doing. We try to balance worldviews. So for myself as an Indigenous person, learning about epidemiology was a big learning curve for me, and I'm still learning. Obviously, I don't have a background in that area. I'm a social worker by training. So, but it's, being able to learn and teach from the students and from each other as we're going. Like I said, our elders really provide that direction and show us, guide the project and where it should go and how it should be done, but also how to do things in a good way. So all of these things together ensure that we're trying to, do things in a good way, look at it holistically. We want to protect our participants, and we want to ensure that they're well taken care of. There's a lot that we could go into and give more examples, but for time, we just don't have the time right now. So.
Oh, next problem.
Oh, sorry. Is it this one or?
The what we've learned, yeah.
Great, sorry.
No worries.
Apologies.
There's so many bubbles. So I'm briefly going to speak to the baseline information based on the Cedar Project participants, just to give you a snapshot of the participants before I speak to the COVID-19 study. So overall, you can see that about half of the participants are women and half are men. About half live in Prince George, half in Vancouver. Over 80% have not graduated from high school, and about 65% had a parent who attended a residential school, and just under 65% have ever been in foster care. Over 60% have ever been incarcerated in their life. The prevalence of HIV is around 7%, and about 35% of the participants are living with hepatitis C. We always need to balance out our data and to present the strengths of the participants. So important. These variables, these indicators that you see here in this list, were developed by our elders who support the study, Earl Henderson and Violet Bazoki. And you can see that strong proportions of all the participants had grown up living their traditional culture. So their family lived by traditional culture, they spoke their traditional language, and they now know how to speak their traditional language. And that's about 45% of the participants. We also see that about 50% of the participants had participated in ceremony in the last 6 months, and we're gaining a lot of strength and resilience from that. We saw that participants were also living by traditional culture and had accessed drug and alcohol treatment in the past 6 months, close to 40%. So you can see the participants are really working hard and doing such a wonderful job of living in a traditional way. So I'm now going to speak to the culturally safe trauma-informed COVID-19 response. You can see here, this is the Zoom call that we were having for our partner meeting to, we are working on planning and developing the COVID-19 response. Next bubble. So in March 2020, as you all know, we had major restrictions come in and there was a major service shutdown, and that included the Cedar Project study and all studies that were going on at the time. And the Cedar Project partnership directed us to do everything we could to stay open. And so we kept our doors open and provided supplies and did everything we could to support participants. But we also knew that we needed to continue on with the research work. So we applied for an exemption, a research ethics exemption, and we were granted that exemption. The major concern of the partnership and the researchers, of course, was that this was all happening at the same time as a toxic drug supply and an overdose crisis happening. And so Cedar was successful in gaining a CIHR and Michael Smith research grant application. Next slide. So there were 3 aims to this study. The first was to look at trends of COVID-19 prevalence and describe engagement with the pandemic response, and really to look at the structural inequities that were preventing people from being able to stay safe and stay home and wash their hands and isolate if they needed to. And what were the impacts of COVID and how much was this disease affecting Cedar Project participants, including people who identify as women, Two-Spirit, and men. Next aim. The next aim was to look at the impact of COVID-19, the COVID-19 pandemic and the response to the pandemic on personal indignities that were being experienced by Cedar participants, and those that would especially impact mental well-being and substance use, especially homelessness, unstable housing, lack of clean drinking water, lack of hot water for drinking and bathing. All of these impacting people's mental health and ability to handle what was happening in the world. We needed to know what kinds of supports people needed, and we were working hard to provide those. Next bubble. Fast. That our third aim was to adapt and implement and test the feasibility of a bundle of strength-based wraparound virtual supports to mitigate primary and secondary COVID-19 impacts. So this was an adaptation of a mobile health intervention that we had tremendous success with for HIV. And we adapted it for COVID-19, and it's being rolled out now. So we partnered with TELUS to provide smartphones for participants. They receive daily text messages, weekly text messages, or daily if they prefer it. And they're provided with wraparound support. And the aim here is to support connections to family, to services, to support relationships, to provide participants with the means they need to get through this lockdown and to get through the secondary impacts of COVID-19. And with that, I think that brings us to the end. And hopefully we have time now for questions.
And there's, I just want to note that, as you can see, there's a lot that more that Margo and I can talk about or answer questions about if you have questions. And thank you so much for your time.
Awesome. Thank you so much. That's a really wonderful presentation and clearly some amazing work being done by everyone at the Cedar Project. I'm really grateful that we got to learn a little bit more. I know we're approaching the end of the allotted time here. I think we've actually even gone over a little bit, but we encourage anyone to share a little bit or share any questions that they have, or ask anything that you want. And Margo and Sherri, if there's anything you want to expand on or add to.
I'll just say that we can share our email addresses as well if anyone has questions or wants to follow up. We'd be happy to connect with you by email. And thanks for putting up with all the technical difficulties.
It was our fault, not yours. We'll take the blame.
Oh, it's expected with Zoom meetings, no problem.
I just put my email in the chat in case anybody wants to follow up with or have questions.
Great. Well, I see a lot of praise, and I think it was a really great presentation to follow the discussion Len started about, using Indigenous worldview and Indigenous knowledge in some of this Western work. And I think from what was shared, there's a lot to be learned from how I think the Cedar Project has really highlighted and elevated the role of Indigenous knowledge and ways of knowing. And I wondered if there is anything you wanted to talk about that really being the focus of how your governance seems to have been structured is in our traditional structures rather than Western methodology.
Sorry, can you say that again? I distracted by the chat.
That's okay. I think just wanting to have a tiny bit of dialogue about how we just talked about two-eyed seeing, where it's more kind of using both Western and Indigenous, and I feel like the way Cedar Project has worked, it's really more Indigenous methodology first, and kind of Western as a secondary piece. Now, I wondered if you wanted to talk about that at all.
Yeah, I think I can just talk about my perspective and the role that I'm on, that I play. So part of the work that Cedar does is we do student mentorship. So the sort of the partners, a few of us partners, not everybody does mentorship, but a few of us partners mentor the PhD students that come in through UBC. So, because we are Indigenous, identify strongly as being Indigenous, we come to that work with that lens first. So the two-eyed seeing is really more probably implemented in the more academic side of things. So writing research articles, applying for ethics, like that kind of thing. But the way that we do the work is very much grounded in taking that Indigenous approach rather than taking a two-eyed seeing approach, because we may have the degree, we may have the academic experience, but that's not how we live our lives, for example. So we really try to, I think it's just natural for us to take that, to approach the work in this very the way that we are, who we are, where we come from. We just kind of that's how we go forward. So that, you know, you could say it's two-eyed seeing. You know, there is a lot of reciprocity in the sense of like, we have to learn epidemiology, we have to know how to read stats, we have to kind of do these kinds of things, but we sort of leave that to the students or, you know, the postgraduates, which there are a couple, to kind of share with us how to look at this, to understand it in a very basic way. But we come from it from a very Indigenous, from who we are as Indigenous people first. It's I think two-eyed seeing lends it to sort of like, you know, there's a bit of a balance, but I feel like for us, it's the balance isn't really, it's not really balanced, is we understand it, we get it, but you know, we're going to look at it from an Indigenous lens before we're going to look at it from any other kind of lens. If that, I'm not sure if that makes sense, but that's how best I could explain it.
I think there's so much value in that, and I really think that it's the kind of the largest or the most well-known example of Indigenous led research that I know of, at least, and I'm really grateful that you're able to share that. I'm seeing we only have a couple minutes left, so if there's anybody else that has any questions, I actually do see somebody just posted a question in the chat, wondering if using Western tools in research with Indigenous people, do you feel that that's inappropriate? And I guess, go ahead.
Yeah, so I've had I've been questioned about this, especially from our allied researchers who feel a lot of guilt around, I shouldn't be doing this, Indigenous people should be doing this. You know, I'm trained in this very Western way that has been harmful to Indigenous people. And my response is always, and will always be, unless, you know, I evolve, and obviously I'll evolve, but my thinking will change, is that there's just not enough Indigenous people to do the work. We need that information, as Charlotte said this morning. We need to be able to do research that is going to benefit us, that is done by us. So if we can train non-Indigenous people to work with us, and to use those tools, such as, you know, epidemiology, surveys, statistics, vaccinations, you know, as it is now, to benefit us and to help us. We have with Cedar, we, you know, as the Indigenous people have control over how the data is shared, how we view it, how it's written about, how we tell our story. It's not written from a, I mean, there sometimes there is a bit of a tension, you know, epidemiologists have to write a certain way. And so, you know, we kind of have to, okay, and I understand that. But we need that support. We need people to work with us to understand what we need from research, and to do it in a way that is going to be respectful. So there's close oversight, there's close working relationship. There is if we didn't have that support by allies, we wouldn't get it done. There's just not enough Indigenous people. So for all you Indigenous people that are here, you know, get your PhDs so that, you know, I mean, I personally, you know, at one point was on 20 grants, and I know Charlotte's like, I mean, I don't even, like, probably 50. So, you know, it's just, there's a lot of demand for us. And that's why we need our allies.
Wonderful. Well, again, thank you both so much. And thank you so much for answering those additional questions there, Sherri. It's really wonderful to hear about all of your work. And with that, I'll pass it over to Margo to start the next session.